Hi, Dr. Pelto here. How is it that you take care of a neuroma, something called a Morton's neuroma? That's what we're going to look at this episode. What we're going to look at today is something called a Morton's neuroma, or just a neuroma. The reason it's called a Morton's neuroma is because it's in the third interspace, so we're going to talk about that in a little bit. So the first thing you have to ask is, how long have you had symptoms? Now, if you've had symptoms for years and years, you should probably see someone. It might be a little bit beyond the scope of this video. Okay. What treatment options have you done before? Have you done anything? Have you tried some of the basics? We're going to go over some of the basics and some of the more advanced techniques. How does this impact your life? Is it something you're limping around all the time? You feel kind of a numbness and tingling in the toes? Or is it something that really doesn't bother you? And so what we're going to go over is what you have, why you have it, and what are some treatment options. So let's get right into it. What is a neuroma? So a neuroma is this little space here in the third interspace. Okay. People say that it feels like a sock is bunched up in the front of the shoe. That's what they say. So if you look at this picture here up on the front here, this is between the third and the fourth metatarsal head. Here is the neuroma. You can see how it's red right in there. Okay. And if you see, there are nerves going to all of the web spaces, and this feeds the adjacent sides of the third and the fourth toe. But there's also one in the second interspace, also one in the first interspace. And this can be caused by a tight, close proximity of the bones. It can also be caused by some other things. I really like this picture here on the bottom. Do you see how it actually looks bigger here, and it's underneath this ligament? This is called the deep transverse metatarsal ligament. It's right underneath there, and it gets thicker. And then it causes this numbness, tingling. It takes up space inside of there. So that's what a neuroma is. The most common symptom is it feels like a bunched up sock in the shoe. Okay, something's bunched up in there. There are other things that are very similar. We're not going to go into those, but this is what this feels like. What imaging do you do for it? Well, an X-ray can help. An MRI can be done. What I find is most beneficial, and here you can see, is this neuroma, this little black thing that pops up here with a diagnostic ultrasound. Okay, here's an example of an MRI where you can kind of see it, and there are some other images, kind of a rendition of what it looks like as it's popping up and down in between the interspace. You can also do an X-ray, and sometimes an X-ray can be beneficial as well. What are the options? Well, you can ignore it. Most people ignore it until it hurts too much. You can try conservative, or the things that we're going to go over today, or you can do surgery. We're not going to go too much into surgery, but try to avoid that if you can, in my opinion. But you may see a doctor that has a different opinion. So how long does it take to get better? My general rule of thumb, pretty much for everything that I treat, is if you had it for over 3 months, it might take up to 3 months. If it's under 3 months, probably get it better in about a month. Okay. Problem is, everyone waits over 3 months. Everyone waits a long time to get treated. So we're going to talk about how you can reduce the pain and control the load, how you can repair the injured tissue, and then restoring proper function, if that's possible, if that neuroma isn't too large. This is the checklist that we're going to go into detail. So if you stick around, we're going to look at all of these different treatment options, okay, and how this can be helpful for you. So let's get into it. What are some of the home treatments? Now, these are things that you can do before you see the doctor, things that we usually start with. So if you haven't tried these, I'll probably start with these things first when you come in the office, and then we'll go to the other things. If you have treated with these things, you can save yourself a visit by trying these things first before you come see me or come see another doctor. So the first is reducing the stress and strain in that area. So for example, if you space out the area between the toe here with these shoes, this can be beneficial. So a couple of brands that I like are Ultras and Topos, and they have a very wide anatomic toe box. This is quite beneficial for you. So a shoe that has a nice wide toe box doesn't allow the toes to be squished and strained. Here's an example of a wide toe box or a narrow toe box. Avoiding a narrow toe box, and here are a couple of other examples of shoes. I'll put my shoe buying guide underneath here so you can get kind of an example. These are called anatomic shoes with a wider toe box. The benefit is they're normal in the heel but wider in the front. Other thing that you can try is something called correct toes. There's different type of toe spacers. These are made to wear in your shoes, and they do space out the toes, and they help reduce the pressure in that inner space region. So this is made to wear with those anatomic type of shoes. You can also try metatarsal pads. So this is the proper usage of a metatarsal pad, okay, which is proximal or before the metatarsal heads. kind of another example of a metatarsal pad. And this is an example, if you really like them, you can also insert them in an orthotic that can take the pressure off of it. All these things are used to offload the area. Here's an example of ones that you can just buy and they stick right in your shoe insert. So before you make the orthotic, you can try them out on your shoe insert. They work pretty well. I'll put a little link here to an Amazon page where you can get them if you're interested. Reducing inflammation, you can do icing. I like contrast baths, 5 minutes in ice water, 5 minutes in hot water, 5 minutes in ice water, or some other type of icing mechanism. You can also reduce the inflammation by taking anti-inflammatories for a period of time. I don't like to go more than 2 weeks. If that doesn't work, you have to do something else. Sometimes reducing tightness can be helpful. For example, if you have a really tight forefoot, that's going to increase the stress in the area of the neuroma. So a tight calf muscle is going to increase stress. So loosening that up with some type of stretching. Now be careful. Don't do like the runner stretch where you kind of push off the wall, because that can actually aggravate this area. I like deep tissue massage. So there's some tools you can use, foam rollers, sticks, things like that to reduce the tightness if you have a really tight heel cord. So what are some doctor-specific treatments? So these are things that you would see a doctor for. So if you've tried those things, hasn't worked out, after, let's say, 2 weeks, 4 weeks, then you should see someone. So one of the most effective things to reduce the inflammation is a cortisone injection or a sclerosing injection. And this can be done with ultrasound. I like to do it with ultrasound to put it right in the correct position. Okay. Here is an example of a video of a neuroma injection. I'm not going to make you watch it again, but I'll put a little link underneath here. But this is me kind of doing a neuroma injection in that area. Let me pause it. Actually, let me walk you through it. So what I do is I push up and down in the area of the inner space, between the inner space right here. And then I try to find that neuroma as it's popping up and down. And then from that, there's an injection thing, and I'll go right between the toes, and then I'll inject the neuroma. So I can actually see it going right in there, and I can inject, you can see the fluid going right in there. So that's kind of a neat thing you can do as well. Also orthotics, like I showed before, making a custom orthotic with that metatarsal pad can be helpful. Also, if you flatten your foot a lot, doing something to help reduce the pronation can be helpful. Occasionally, this isn't for everyone, but certain patients, you can use shockwave therapy. So if the nerve is inflamed around it, the shockwave therapy can help. If there's a lot of scarring in the nerve, it's not going to reduce that scarring or that thickness. The sclerosing injection or cortisone injection is a little bit better than that. And then also a walking boot or something else like that can be helpful in certain cases. Last option is to do neuroma surgery. That's actually where we remove the neuroma. You actually take the nerve out and you cut it as far as you can at the front and then at the back, and take that out. You're going to have numbness to the adjacent sides of the toes. Occasionally there can be nerves crossing over, and then the risk of that is a stump neuroma. So there are some advanced treatments for this. A shockwave is one, amnio injection, or some other type of sclerosing injection in platelet-rich plasma. They might work for it. Some patients it works for, it might be an option for you. And then surgery, if we can avoid it, we will. Once again, this is the checklist like I talked about. You'll probably get an x-ray first and probably a diagnostic ultrasound. If you're considering surgery, your surgeon might get an MRI. And ways to repair and heal, it would be shockwave. Reducing inflammation would be the cortisone. Reducing tightness. I don't find physical therapy all that helpful for neuromas, just so you know. But the anatomic shoes I do find, orthotics I find helpful, and then sometimes surgery. So I hope you guys found this helpful. And certainly if you have any questions, please write them underneath. Okay, thank you. Hi, I'm Dr. Don Pelto. I'd like to welcome you to my YouTube page. And on this page, you're going to find a lot of resources that I've set aside for you if you are my patient or if you're here just learning about your foot condition. I'd like to give you a little tour and share a little bit about what we have to offer on this website. First, I've had it organized by my patient resources. These are resources such as our office newsletter, our webinars that we do, or different types of things I'm providing specifically to patients in the office. As you scroll down, what you'll see is a section that's called Ask Dr. Pelto. You can submit your own question and I'll answer it in one of these episodes. And then what you'll find are a list of videos based on topic under the foot problems. And at the end, what you're going to find are my books. Put a little link here on the upper right-hand corner. If you click that link, you're going to get a link to my website. And on here, you're going to find a list of my books. I want to thank you for visiting drpelto.com on my YouTube page, and I look forward to helping you or educating you with this information.